Unexplained weight loss. Have you lost weight without trying? Maybe your clothes suddenly feel loose. Maybe friends are asking if you've been dieting. Losing a few pounds isn't always a concern. But if you lose a significant amount of weight without changing your eating habits or exercise routine, it's worth getting checked. Some cancers can change the way your body uses energy, causing weight to drop unexpectedly. Think of it this way. If money keeps disappearing from your bank account and you don't know why, you'd investigate. The same applies when weight starts disappearing from your body. Extreme tiredness that doesn't improve. Everyone gets tired. Cancer-related fatigue is different. It's the kind of exhaustion that sleep doesn't fix. You wake up tired. You rest and still feel drained. Simple tasks feel harder than they should. Many conditions can cause fatigue, including stress, poor sleep, anemia, and infections. But persistent, unexplained exhaustion deserves attention. Listen to your body. If you constantly feel as though you're running on 1% battery, don't ignore it. A lump or swelling anywhere in the body. Many people automatically think cancer when they find a lump. The good news? Most lumps are not cancer. However, any new lump, swelling, or thickening that doesn't go away should be assessed by a healthcare professional. Common places people notice lumps include breast, neck, armpit, groin, testicles. Rule of thumb: if it's new, growing, or feels unusual, get it checked. A cough that won't go away. We've all had coughs after colds or chest infections. But if a cough lasts for several weeks and isn't improving, it's worth discussing with a doctor. Pay particular attention if you're coughing up blood, your voice becomes persistently hoarse, you feel increasingly short of breath. A stubborn cough doesn't automatically mean cancer, but it should never be ignored. Changes in a mole or skin mark. Your skin often tells stories about your health. Watch for moles or spots that become larger, change color, develop uneven borders, bleed, itch persistently, look noticeably different from your other moles. A useful question is, does this spot look different from the others? If the answer is yes, get it examined. Bleeding that isn't normal. Unexpected bleeding should always be taken seriously. Examples include blood in your urine, blood in your stool, bleeding after menopause, bleeding between periods, coughing up blood, vomiting blood. There are many possible explanations, and many are not cancer. But unusual bleeding is your body's way of saying something needs attention. Changes in your bowel habits. We all know what's normal for us. That's why changes matter. Watch out for persistent diarrhea, persistent constipation, needing the toilet more often, narrow stools, feeling like you haven't fully emptied your bowels, blood in your stool. If these changes last for several weeks, don't simply hope they'll disappear. Changes in your bladder habits. Your toilet habits can reveal a lot about your health. See a healthcare professional if you notice blood in your urine, pain when passing urine, going much more often than usual, difficulty passing urine. Most causes are not cancer, but these symptoms should never be ignored. Difficulty swallowing. Food should go down smoothly. If swallowing becomes difficult, painful, or feels like food is getting stuck, get checked. Some people adapt by eating softer foods without realizing something more serious may be happening. Your body should not have to struggle with a basic function like swallowing. Persistent indigestion or heartburn. Most people experience indigestion occasionally, but ongoing symptoms that continue for weeks or months deserve investigation. Pay attention if heartburn keeps returning, eating becomes uncomfortable, you feel full very quickly. Symptoms don't improve with usual remedies. Persistent digestive symptoms should never become your new normal. A sore that doesn't heal. Our bodies are remarkably good at healing. Cuts close, scratches improve, mouth ulcers disappear. When a wound, sore, or ulcer refuses to heal after several weeks, it needs medical attention. This applies to mouth ulcers, skin sores, wounds that repeatedly break down. Healing problems can sometimes be a warning sign that something deeper is happening. Persistent pain. Pain is one of the body's most powerful alarm systems. Many aches and pains are harmless. However, pain that doesn't go away, has no obvious explanation, gradually worsens, should be assessed. Pain doesn't always mean cancer, and many cancers cause no pain at all in the early stages. But persistent pain deserves investigation.